Alison Demers, thank you so much for listening to Community Access. My guest today is owner and founder of Columbia Dental, Dr. Abbas Mohammadi. Good morning, doctor.
Good morning, Alison. How are you?
I'm well. How are you?
Excellent.
So you have this amazing event coming up to celebrate Valentine's Day, to give back to the community. Tell me about it.
Correct. Is Valentine's Day is coming. It's February 14. We're going to have the event on Sunday, February 9th, and from 12 o'clock to 12 p.m. to 7 p.m. First come, first serve. We provide them free cleaning in the preparation of the Valentine's Day. Coincidentally, is a Super Bowl day too.
Yes,
so
it is.
People they can go with nice clean teeth and go and watch and enjoy the Super Bowl. I'm sure they're going to eat some Cheetos, potato chips, but at least we try to mitigate some of the damages that will happen during the Super Bowl time.
And it's at 483 West Middle Turnpike in Manchester, like it always is?
Yeah, like always, correct.
And it's first come, first serve?
Correct.
So you've been doing this Thanksgiving, Christmas, you do these free cleanings for the community. Why would you do this?
The answer is very simple. Without supporting of community, no business can be survive. This is just go give back to the community. Our success, survivor, all depend on the community. We are in the public services, and we understand that many people either they don't have insurance or the insurance that they have not been many doctors they don't accept those insurances, so it's a good way to give back to the community.
Yes. And your staff enjoys being there on those days?
Absolutely. They love it. They get so many volunteers to come and help. Yeah.
How many people have you seen on the past events for the free teeth cleaning?
We see something between 30 to 40 patients. Yeah, depend on that. Christmas was a little bit slower, of course, you know why, but other events like we had on July 4th or we had on Thanksgiving, a lot of people, they come.
And if you're listening, you can go to columbiadental.com for more information about this event.
Correct.
Today, you'd like to talk about pediatric dentistry. What does a pediatric dentist do?
Okay, so we all are dentists. Obviously, I am not pediatric dentist. I'm a general dentist, but those pediatric dentists, they went for additional 2 and sometimes 3 years more training to learn about the primary teeth, because primary teeth or baby teeth are they have a different biology and physiology than permanent teeth. So it's like same thing that you take your child to a pediatric physician. You're not taking it to the general physician.
Mm-hmm.
So same thing. Is that first of all, scientifically we're talking about different physiology, but from behavior management also. These pediatric dentists, they've been trained how to approach the kids, because the first impression is everything. Most of my adult patients, when they come to me and they start to telling their bad experiences when they were child with the dentist. So I do believe that every child from 2 years, of course the pediatric dentist see the patient up to age 14, but I would say to at least age 7, 8, they need strictly to be seen by pediatric dentists, because these dentists, they are well trained and they're going to provide or bring in a very good impressions with the children, which that they stay with them for the rest of their life.
Yes. We talked before how my daughter, when she was a little girl, went to your place and they had the bubblegum smelling gloves.
Yeah.
There were, I think, video games and movies. So she was fearful, but when she sat in that chair it all went away. And it was all because of the atmosphere that she was in and the kind words and the loving disposition.
And the approach of the doctor.
Right.
You know, and the approach of the doctor.
So why is it important to take your child to a pediatric dentist?
Again, because same thing that I told you, you know, both, you know, from scientific point of view and both also from behavior management and psychological approach that these dentists are expert on.
How many pediatric dentists do you have at your business?
Currently, we have two very experienced pediatric dentists, one in Manchester and also in Rocky Hill locations.
You also have an orthodontist at your
Correct, and we have orthodontist that it works along with the pediatric dentist, and we have a center. It's called Pediatric and Orthodontic Center in Manchester that the orthodontist and pediatric are working together because and they have to my belief the pediatric dentist always has to have an orthodontist in the same place because lot of problem with the orthodontics it can be prevented at the development age. Unfortunately, lot of people they come and see the orthodontist when all the teeth been erupted and they realize the bite is not correct or doesn't look good or the teeth are crowded or crooked. But a lot of these things can be managed and prevented very easily at age, let's say 7, 8, 9, rather than the patient comes at a later age. At that time, then they need to go through an extensive, you know, orthodontic treatment, maybe for 24 months or even sometimes more.
Yeah, I think we had to wear them for like 4 years when I was growing up.
Yes, you see, but because if the pedodontist that works along with the orthodontist, they catch the problem at the earlier age, a lot of it can be prevented. So they eventually, yes, they might need orthodontic treatment, but it's going to be way simpler and the duration would be way less.
So the child would be at the pediatric dentist, and then the pediatric dentist would say, I think you need to see the orthodontist.
Correct.
Yeah.
Correct.
So they work hand in hand.
Hands on hand. Of course, the pediatric dentist does not, treat the orthodontic patients, but at least understand that it might be an issue.
So when should a child, do you think, see an orthodontist usually?
Best age is around 7 to 8 years old.
And when do they get braces?
Usually around age 12 and 13 they start. But again, some cases can be start sooner if we feel that it might be a skeletal issue. Not because the orthodontic treatment can be stem from two issues. One is dentition, means the teeth, but the other one are a skeletal issue like the jaw growing. So the jaw growing, if is any issue or problem, can be detected maybe at age 7, 8. So it can be addressed way earlier than wait and all the teeth are get erupted and then start orthodontic treatment.
I remember one of my daughters had, I think it's called a tongue thrust, where they push.
Yes, yeah. And yeah.
Go ahead, doctor.
Yeah, and that make the teeth to not touching the top teeth with the bottom teeth. I understand you.
So what is the process now for children who need braces? Do they still do the mold over their teeth and they pick out the flavor of whatever the mold is?
There are some newer stuff available, but yes, conceptually it's the same process to go with it. Maybe taking mold, it become more like these days. We take a digitalized impression rather than take those, bulky material and so and so. But yes, the concept is still the same.
And for parents who are concerned about the cost of braces, what is it like today?
Well, cost is again depend on how complex is, and that would be determined on the consultation visit. Our orthodontist, we have a free consultation policy in our orthodontic.
Wonderful.
Yeah, because the cost can varies. So at that point, they determine how complex is, and also we working with the third party companies like Care Credit or Cherries. They start that they can finance, so people they can pay the cost of the treatment over the times.
Do you still do the different color wires for the kids?
Yeah, sure, of course, yeah.
You make it nice for them.
Sure, of course. Yeah.
Anything else, doctor, you want to talk about concerning pediatric dentistry or orthodontic work?
The other thing is that also these pediatric dentists are expert of using nitrous oxide or laughing gas, and which they use it, so sometimes it helps the children to calm down, so they've been trained for administration of those nitrous oxide and managing the patients. So that's I think the only thing I left.
There's so many videos out there about children who've gotten it, and then afterwards they were saying the silliest things, or the behavior is funny.
Exactly.
It's
Yes.
so great. I have my daughter on video doing that.
Yeah.
It's hilarious.
And it's very safe, and it's done in the office, and it make the children to have again good experience.
Yes.
So it's not again approach that I told you, just the psychological approach or behavior manager, which they are expert. Also, they in certain circumstances they try to approach pharmacologically and using medication or some type of nitrous oxide or laughing gas to calm down the patients.
Sure. I mean, the parent's nervous, the child is nervous,
Correct.
and now you're helping everybody,
Correct.
and then you're getting the work
Correct.
done that's
Yeah.
necessary.
So unfortunately, also we see in our pediatric places that already some of our patients are coming already with the bad experiences. So those are the one that the one that they have a good experience. I've seen it that usually we manage it and based on behavior management or some tactics, bubble gum,
Yeah.
environment, video and stuff. But unfortunately, when the bad experience established, that it make it, of course, harder for everybody.
Sure.
And those are the times that they are using more medication or pharmacological approach rather than psychological approach.
I still think it's better than holding them down and they're screaming, and it's just
Oh no, we don't.
No, you don't do anything like that. I'm saying,
used to be.
when I was growing up, that's
Yes.
how it was.
No, that's I don't, and I don't know. I'm not sure even in Connecticut is legal to do
No,
that. Yes.
no.
But
Well, that's wonderful.
all right.
So you have this event coming up. It's for Valentine's Day, but it's on February 9th, a Sunday from noon to 7. It's a free teeth cleaning. It's the day of the Super Bowl. It's from noon to 7, as I said. It's at Columbia Dental at 483 West Middle Turnpike in Manchester. First come, first serve, free teeth cleaning. You don't need insurance. You don't need money or anything. You can go to columbiadental.com for more information.
And we don't care if you're fan of Chief or Eagle. We serve everybody.
Thank you for speaking with me today. I'm speaking with owner and founder of Columbia Dental, Dr. Abbas Mohammadi. Thank you so much for serving the community.
Thank you so much.